Hi, everyone. It's been a while since I've posted anything on my YouTube channel, so welcome back if you've been following me for a while. Sometimes life just catches up with us and we don't do a lot of the things that we intend to do. So here I am. It took a ice storm in Oregon to kind of have some space and time to feel creative and feel like I had sort of the mindset to do another video. So I want you to come into a comfortable position. I like to say that we want to balance the pelvis in the seated position. So what I mean by that is that when you sit in whatever position you choose, I've chosen to sit on a bolster in what we call easy seat. And I'm trying to balance my weight between my two sit bones. Those are the bones that are prominent in the buttocks. And what that does is it keeps the weight off of my tailbone and it keeps the weight off of my pubic bone directly and places my weight directly in the center of my pelvic floor. So from this position, I can best feel that movement of the pelvic floor with the breath. And as with all of my videos, we're going to start with breathing. So I want you to perhaps close your eyes. And first, just start to notice the breath as it moves in and as it moves out. Notice the quality of the breath. Notice the depth of the breath. Notice the texture of the breath. Is it rough or is it smooth? Is it gliding in easily or is there some efforting required to inhale and exhale? And if you've chosen another way of breathing, see if you can make sure your mouth is closed and that you're breathing in and out through the nostrils. The nostrils are very important for warming the air, for filtering the air, and for producing a chemical that helps with blood vessel dilation and relaxation of the blood vessel walls. So when we breathe in and out of our nose, we actually have this extra benefit of calming the nervous system and bringing better blood flow to our tissues. And now, as you're observing the breath, see if you can deepen the breath and notice if there are any muscles that are resisting the breath moving in and the breath moving out. See if you can allow the abdominal wall to move, allow the bottom of the rib cage to move. And if you like, you can place your hands on the bottom of the rib cage. You can place your hands over the upper belly and feel for movement here. The inhale, it rises, it expands, it becomes spacious. And on the exhale, it returns to that rest position without a lot of efforting. And if you found it helpful to put your hands on the outside of the rib cage, see if you can now put one hand just above the belly button and one hand mirroring it in the back and breathe into that space. We like to call this type of breathing 360-degree breathing because the rib cage is opening in all different planes, all the planes forward, backwards, side to side. And as the diaphragm is moving down and up, inhale, it moves down, exhale, it moves up. See if you can feel what's happening in the base of your pelvis, in the pelvic floor, and see if you can notice that on the inhale, there's a bit of a spaciousness. And on the exhale, a little bit of returning back to a resting position. Inhale again, feel that spaciousness, feel the opening, maybe a little widening between the sit bones. And then on the exhale, coming back to center. Let's practice that one more time. Inhaling, ribs move, belly moves, and the pelvic floor gently opens and receives the breath. And we exhale. Nice analogy for that movement is if you had one of those beautiful, colorful fans that we oftentimes see in Japan, where the fan opens and it closes. So if you can transfer that movement into the pelvic floor, we inhale and the fan opens, and we exhale and the fan comes back. And one more time, inhale, really want you to feel this movement. And then exhale. So the ideal time to contract the pelvic floor is going to be on that exhale, because as we inhale, the pelvic floor has to open and receive the breath. So on the next exhale, what I'd like for you to do, and I'll talk you through it, is to gently lift the perineal body. If you have male genitalia, lifting the scrotum, and see if you can feel that upward movement of the pelvic floor that's coupled with the exhale. So again, there's this inhale, this opening, this spaciousness. And on the exhale, gently try to contract those muscles in the pelvis as if you're trying to stop urine, stop gas, and it lifts up very gently. And then we'll inhale again, allowing that spaciousness, allowing that openness. And we exhale and gently squeeze and lift. So I'm going to talk you through about 5 10-second contractions here so that you can start to feel how that rhythm of breath can be a catalyst for the contraction of the pelvic floor, but that we can also slow down our breathing to match the contraction. I like to say that the breath tells the body when to move, and so we can match our movements to the breath. So we'll take a breath in through the nose, allowing the expansion that we've already experienced. On the exhale, see if you can squeeze and lift, and exhale slowly. 2, 3, 4, 5, 6, 7, 8, 9, 10. And inhale to release that. And exhale, let it go. And we'll inhale again. Exhale, gently squeeze and lift. 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale. And exhale. Inhale again. Exhale, gently squeeze and lift. 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale. And sigh it out. Let all the effort go. 2 more now. Inhale. Exhale, gently squeeze and lift. 2, 3, 4, 5, 6, 7, 8, 9, 10. Release, inhale. And let the breath go. And one more time, inhale. Exhale, squeeze and lift. 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale. And let it go. I invite you just to close your eyes for a minute. And just kind of notice, come back to regular breathing, normal breathing, nice gentle in and out of the air. Let go of all the effort. And I want to call your attention to a couple of things that were happening as we just did that exercise. One is that I was counting out loud. When we speak, counting is the easiest form of speaking because we've all been doing it for a long, long time. If we are talking out loud, we are exhaling. So a nice way of kind of getting that breath to slow down a little bit is to speak. Now, I talked about exhaling through your nose, and that is a great way too, over time, for you to get that practice of always keeping the mouth closed, except when speaking. But as we're kind of training the breath and training the pelvic floor, it's not a bad idea to count out loud or speak out loud as you're holding the pelvic floor. So the other type of contraction of the pelvic floor that's very important for us to practice are going to be those faster contractions. Many of my patients come to me and think that that's what a Kegel is. Well, actually, anytime you contract your pelvic floor, you're doing a Kegel or a Kegel. But the faster ones exercise a different type of muscle fiber. And so what I want you to do right now is try to just quickly squeeze and release the pelvic floor. And squeeze and release. And see if you can feel that same upward, inward movement that you felt when you were doing the longer holds. When we are working with the breath, with those faster ones, because we're turning the muscle on for a second and off for a second and on for a second and off for a second, we're not going to be breathing that quickly. So again, what you can do is match the squeeze with speaking. And I'll demonstrate, and you can do it along with me, or you can just watch, and then we'll do it again. So we're going to inhale. We're going to exhale. 1, squeeze, release. 2, squeeze, release. 3, squeeze, release. 4, squeeze, release. 5, squeeze, release. 6, squeeze, release. 7, squeeze, release. 8, squeeze, release. 9, squeeze, release. And 10, squeeze, release. So if you were able to follow along with that and you have the privacy and you can count out loud, go ahead and count out loud. We'll do one more set of those faster twitch contractions. So ready to prepare, take a breath in. 1, release. 2, release. 3, release. 4, release. 5, release. 6, release. 7, release. 8, release. 9, release. And 10, and release. Now let's come back to just some gentle breathing, focusing again on the movement of the rib cage and the movement of the pelvic floor. If you like to put your hands at your rib cage to feel that, go ahead and do that. Or if you liked putting your hand front and back, you may do that. So take a breath in. Feel the expansion and the spaciousness of the pelvic floor. Let it out. Breathe it in again. Open. Receive the breath. And breathe it out. And then we'll go one more time, breathing in. And breathing out. So this short video was all about getting you to tune into breathing and pelvic floor contractions. We'll do another video on bringing those pelvic floor contractions and the breath into some simple movements. That's all for now. Bye now.